Hi, everyone. Suzette Martinez Valderas here on this magnificent Friday. Our last, actually, second to last Friday before August is here. And it is just blowing my mind how long, yet how quickly it seems this year has flown by. Unfortunately, I think it's thanks to a lot of chaos and unknowns that seem to be hitting us every month. Um, as you know, last week we were given another stay-at-home order and economic shutdown, so life is continually changing for us. But today I'm really excited to bring on an amazing doctor and somebody who I recently met, and I could literally spend hours on the phone with her, Dr. Sherry Sami. A little bit about Dr. Sherry Sami before we get started is so she's actually an expert in holistic pediatric dentistry, and it's more than that. But for those of you who have been following me for quite some time now, you know that my experience and my history in advocating for the special needs community and for the early learning community have I've been very passionate about for years. And one of the things where I've found synergy in doing advocacy for these two communities is really looking at the social and emotional impact that early learning, that access to early intervention services, and or the social and emotional development for individuals with special needs. I've just been immersed in that world for so long. So when I met Dr. Sami, I like her background and her expertise. I just feel like she's amazing. So Dr. Sherry Sami is a graduate of Columbia University. She completed her residency in pediatric dentistry and orthodontics at UCLA, University of California, Los Angeles. She later served as a clinical instructor at UCLA as part of both the pre med and dentistry programs. It was during that time that she became one of the creators of the Children's Health Advocacy Training curriculum. Collaborating with pediatricians and dentistry specialists, Dr. Sami designed one of the first integrative residency training programs that incorporated Western medical practices with other intuitive holistic interventions. For her, comprehensive healthcare means recognizing that the patient as more is more than just physical symptoms, and that mind and spirit play an essential role in our state of health. Through her comprehensive approach to care, Dr. Sami has seen integrative treatment make dramatic differences in the lives of patients dealing with allergies, ADHD, and even autism. While away from her dental care, Dr. Sami enjoys being a wife, a mother to her two children. She practices yoga and meditation and is an avid hiker. So, with no further ado, the amazing Dr. Sami,
Hello.
welcome.
Hi. Thank you so much for having
It's
me. It's such a pleasure.
Oh my goodness, it's so great to have you. I'm so excited. I'm probably the most nervous that I've ever been in doing a
Why?
Facebook Live, and I don't even know how many I've done. It's because I just feel like there's so many good topics that we can broach that apply to what's going on in the world right now. So it's
Yes.
it's more maybe more excitement than nervousness because I think that the things that we're going to talk about are really relevant to today. But let's go back a little bit before COVID-19 and go back to kind of your story. You're an immigrant from Iran. You came here as a teenager, and how tell us a little bit about that, and tell us about how you found a love for dentistry, or how you found that career path, and then holistic medicine.
Yeah. Well, thank you so much, first of all, for having me. I feel so blessed to have so many different platforms where we can all share the love of what we have, which I think for us is children, um, and in all health and well-being of children in all levels, not just physical but also mental, emotional, and even spiritual. And it's truly a blessing to be sharing that with your audience and your followers. So yes, I did come like as a 14, 15-year old and from Iran, and what ignited me in the beginning was a disease where I had it was called brucellosis. It's a bacterial infection. When it landed me in the hospital for 6 months without being able to walk or even go to the bathroom. I was completely bedridden, and there was a lot of ambiguities and uncertainties. And and I didn't necessarily receive, I received excellent medical care. However, I didn't receive much of an emotional um, and support, especially as a 15-year-old that was hearing all of these things. I was merely treated as a disease, not, that needs to be discovered, rather than a human being with a disease. And that really motivated me and with a temporary disease, because we are all miraculous beings that can heal. We know people that they were given terminal stuff and they completely miraculously healed from it. So I made a vow to myself to, first of all, work with children. And I did so many different things not to do that. I went became a biochemist, and then every day I ended up finding myself at Lucille Packard Children's Hospital volunteering with cancer patients. And then one day I turned around and it's like, why am I avoiding this calling? This calling of working with kids and in a larger way, and just being really engaged with them. And I always wanted to become a doctor. I didn't know what capacity. And I don't know if necessarily dentistry called me. I think healing called me. And within that healing, I use the mouth as the beginning of the health, and I dive into all aspects of health. My clinic right now, it's an integrative clinic where I have nutritionist, acupuncturist, myofunctional therapist, rebreathing educators, craniosacral therapist, osteopath. I mean, just to really attend to so many different things of that a child that health is. So it does have inquire a lot of different things, requires that. So I get excited about looking at these children, that they come with certain labels and certain diagnoses. This person is on the spectrum, that person is ADHD, that person has CP, and really finding health within them. And the definition of health is very different than what it's taught to me at medical school and dental school. um, Finding the health for that individual and making sure that their light is fully shown. I think that each one of us, we have a certain light within us. And when you take the hindrances off, then that light comes fully out. So that I see that as my ministry, almost like it's much more than just a patient doctor relationship. It's like I call them my work children. So it's an advocacy for many families and things like that, for me to bring forward everything that I'm learning within that, from nutrition to gut health, to airways and postures and fascia, and so many different things into the whole picture. And it starts from the mouth. So that's where it is.
So you have an amazing story, first of all. And,
Thank
as
you.
you were talking, some of the things, I realized my own experience and trend or experience in healthcare. So, as well as my advocacy work, have really led me to also look at a holistic approach when dealing, with children. But for me, and oh man, back in 2015, a week before my wedding, I was in a horrific accident. I broke 7 ribs, fractured my sternum, punctured my lung. So it wasn't as long term as you, but I was in rehab in the hospital for about 14 days, and literally, went from being an active, person ready to get married in a week and go on a honeymoon to Hawaii, to not being able to brush my own teeth, wash my own hair. I'm having to learn all of these different aspects of just how to to function again, just normally. Um, in that experience, I realized that there was my doctors were, I had, pain management, occupational therapists, all these different doctors helping me during that time. But a huge realization for me in terms of really needing to look at emotional health was when my mom got sick. So she was diagnosed with stage 4 pancreatic cancer. Um, at the time, I found myself being her full time caregiver, responsible for advanced directive. I was on an end of life journey that I didn't expect to be on with her. And I remember in the early, stages of her diagnosis that, it was very impersonal. It was just, yes, you're diagnosed, there's nothing we can do. Um, and I noticed a huge difference between what I think most people call bedside manner, between regular doctors and then her palliative doctors, and then really those that were responsible for her hospice care, doctors, nurses, social workers. There was really a much more mental health whole person approach. So, what is the difference between holistic with a W, holistic without the W, and why is it lacking in medicine, whether it's dentistry, whatever practice, and what's your experience with that?
Great questions. And I think we talked before that I shared much of your experience as well with my mother and my dad. Both of them passed away at relatively young age for nowadays, in their early 60s, So and I had to kind of walk them through that journey of transitioning, and I learned so much because of it. But when, to me, holistic with an H, it's more about, what do you use in order to treat the patient? Um, are you using supplements versus, antibiotics and medications? Are you using, like, what are some of the means that you're going through that? And often it still includes the cause, or looking at the cause rather than just the symptoms, but sometimes not. um, and it doesn't necessarily look at mind, body, spirit in the wholeness. For me, at least, holistic with a W, that means you're looking at the entire person that is sitting in front of you, the entire generations before this person, because you're not just you are your mom and dad and grandparents, and like at least 6 7 generations, including all the physical trauma, emotional trauma, and mental trauma that your generations before you has passed. And your in my opinion, my intention is to not necessarily like heal myself, but also heal the past generations as well. So then I don't pass it on to my next generation. So there's a lot more, there's a lot bigger picture. And then you're looking for causes, not necessarily symptoms. So if you go to your physician and you say, I have, stomach ache, they will say, okay, well, let's look at it and let's give you some acid reflux medications. Maybe we'll just kind of put a camera and see if there's anything wrong. But I would start with like a larger conversations. What is your gut health looks like? How many times are you, excuse my language, pooping per day? What does that look like? And then is there, were you a C-section or a vaginal birth? What happened in utero? Were you breastfed? What was your diet like? What was your mom's health like? What was the intergenerational trauma in terms of physical, or where you're coming from, it looks like. So I get to know you as a person with everything else that it's around you, and that conversation leads me to better serve you in your wholeness, because I might suggest, oh, maybe temporarily taking that acid reflux, but I'm going to look for much deeper healing within the context of healing your gut, within the context of healing some of the emotional things that create perhaps stress or belief system within you that it's causing that acid reflux. So it's very different in terms of that. And then your next questions in terms of bedside manner is, I remember there was, we all take what we want from our education, right? And I received an excellent education. But I remember there was my favorite part of Columbia University was this psychologist that was one of our faculty, and she would put a little camera in, hidden camera in our cubicle when we were treating patients, and she would actually videotape us. And then after that, in a small group, we would get some feedback about how we were with patients, right? Not just what we said, but how we were with a patient. And I remember this one guy who was, we were discussing, and he asked us certain questions, and right away, like, the patient started like tears coming down his face. However, he never really looked up from his paper to really see those tears,
Mhm.
right? So he just kind of went to the next question and the next questions and the next question. And our teacher, our professor asked, like, did you see how vulnerable she was? Because no, it's not my job. He says, like, it is, because perhaps underneath that vulnerability, there was something else that could be revealed that has much, much more impact on her health than the little questionnaires that you're supposed to get to the bottom of. And at least for me, that had a huge opening, that how I am with the patient is the biggest prescription that I can ever write, because I can have a healing present on that patient. And without necessarily even, giving a lot of advice, I can start their healing journey. Or I can just be, doing everything that I'm taught to do. And I have a lot of information in my head, but not necessarily have that impact. And which one does it inspire the patient more? What we have seen is when you actually sit with a patient and they feel heard, seen, loved, acknowledged, they're so much more motivated to follow your advice than if they just feel like next, next, next. They've just come to a doctor that cannot wait to get out of that room, because he has like 30 other patients or 50 other patients to tend to. So I think that at the end of life, what happens, there's a preciousness that comes, because we talked about that. It's just a cycle, right? I spend the time with my mom passed the same time that my daughter was born. So, I was going breastfeeding my daughter and then coming back and feeding my mom through a G tube. I was changing my daughter's diaper, and I was just baffled of, not baffled, but I was just really, really taken by how between this stage and this stage, what a short journey it is, and how everything is a cycle. So I think that perhaps that those people, the physicians and the, all the healthcare workers, that they spend their life, at the end of life, they understand that preciousness of what life offers, and there's a lot more mindfulness that comes, and a lot more conscientiousness and honoring that comes to this human being that is just transitioning, right? Versus we're just trying to give you a pill in order to take the disease away, which is what sometimes we're trying to look at even with the COVID. It's like, are we
Right.
just trying to kind of come up with a fast, solution in order to take a virus away, or are we looking at things in a much, much more holistic way of like, what is not working?
Right.
How there's 120 million diabetes cases in the United States, how our food sources perhaps might be a part of the problem,
Mhm.
how the lack of connections of how fast we are going and how quickly we're passing by each other, is it could be a source of some of our mental health issues. So I think I look at it as life continuously bring forward so many jewels, and this
Right.
is even for this chaotic time. What are some of the lessons that we can kind of take a look at and take a more holistic shift
Right.
that can bring forward the changes that we need?
There are so many segues that can go off in there,
I
but
know, I know.
um, me, I remember that own experience with my mom, being at the hospital with my daughter who was one, bringing blankets or the stroller, breastfeeding my mom and my daughter in the hospital, and then going to help take care of my mom. But really being there to also ask the questions of the doctors, to take that, the holistic approach. I didn't even realize I was doing it at the time, but when you're caring for somebody, whether it's your infant or your mother, you look beyond just the task, right? You look at the emotions of it, the quality of life of it. So it's amazing that you were able to identify that and really make that part of how you want to serve in medicine.
Yeah.
To get back to poop, so I'm in childcare. That word comes up frequently. I'm not afraid to bring the word up. So it just has me thinking about children. Why is a whole person approach so vital, especially when serving children and our special needs community? Because we need to look at the lifespan, but I think looking at the beginning of life, and whether it's children or even with special needs community, why is that so important?
I missed one because you're kind of breaking up a little bit. So I missed why. What is important? There was one word that you kind of got
Why
scratchy.
is the whole person approach vital to serving children and specifically teaching
Especially the whole
children?
child. So I'll start with a story, of one of my sweet, sweet, precious patients who came to me. He's now 17, but he was 8 at that time that he came. He didn't speak at all. His family hadn't really understood him, So like when he would speak, like it would come out as gibberish, and not audible. He could walk and talk. They put a lot of label, like he's on the spectrum, he's this, he's that, just a lot of different things. And I sat with him, um, and he kind of went through something with me, and trying to tell me some stuff about himself, but sadly I couldn't understand it in the language that he was speaking. But there was one thing that he started showing me, this booklet that he had, and he kept saying poetry, poetry. So I looked at his little book, and I noticed that he's trying to write poetry. And so I asked him, I said, "Are these your poems?" And he nodded. And I said, "I would love to read more, from these poetries." And so then I went back. I usually take the parents back into a room rather than in front of the child, because there's a lot of things that our children, they might hear that might be misunderstood. And I asked Dad, like, "What's your story?" And the story was really, really heartbreaking. He had a wife that was depressed, significantly depressed, two autistic children, one completely non-functional, and then the second child, a functional, autistic child. And the mom actually took her life in front of the two children. One of the sons ended up in a special home group, and because it became really challenging to take care of him, and in the midst of everything, he had a heart attack at the age of 40. So just like the chaos of the whole thing, this man sat in my office and just cried for 2.5 hours. And I told the rest of my staff, like, please contain the rest of the people, because I can't interrupt this session. He just needs to kind of let everything out. And at the end of it, he's like, "Oh my God, I've never spoken." Every time that I go for my son, nobody really asks about me, and nobody asks about what is my health. So, and the simple thing, I said, "How are you doing with all of these things? How are you handling? This seems a lot on your plate, and that's what broke all the tears. Um, and there was a shift in his whole face. We usually say that the patient doesn't get better until the doctor gets better. I also say the child doesn't get better until the parents get better.
Yeah.
So I really believe that so much of the healing also starts with the parents. So there's these, in special needs, patients, there is an overwhelming amount of responsibility that comes for so many of these parents. And nobody really asks them, "How are you doing with all of these things? What are you doing that serves your souls, that fills your cup?" So they're kind of going and going. So what the short of the story is, the next time that he came, he brought me his book full of poetries, which were so brilliant. And then he started something that it was so magnificent. We did start working with some of his nutritions and taking some of the food that
Mhm.
were inflammatory and creating the fogginess and everything. But he started talking normally, like within probably 6 months, completely audible after probably 5 years
Wow.
of speech therapy and everything. And then he continues to write poems, amazing poems. I feel like such profound poems. And he started integrating into the whole regular aspects of, the school. He didn't necessarily have to go to a special school. Dad and him, they have taken a lot of overnight hiking trips, which he adores and he really cherishes. And now he's actually volunteering for the Sierra Club, and doing a lot of like guided hikes,
Wow.
for many people, speaking in front of people and taking them through things. So
Right.
those stories, other than the physical aspects of his health, I feel and I really believe, if I hadn't asked two questions like, what is it that you're writing? So he could be seen and heard and inspired to do the
Right.
things that, because he felt I care. Um, and then asking the dad, like, how are you doing in with all of these things? It started a deeper healing journey that I don't think I could have provided with just all the information that I have in my head about the physicality of stuff. So
Right.
I think that part of it becomes especially important with a special needs, because there's a lot more. There's more often that they're not necessarily seen for the majestic being that they are, for
Right.
the wholeness that they have, for what they are here to do, in my opinion, spiritually, to bring so much more kindness, to upgrade us in terms of seeing the whole and seeing kindness and being compassionate. I don't know a single sibling of a special needs child that's not an upgraded version of really humanity, and just so much kinder and sweeter and
Right.
more considerate. So the same goes with so many families. It just changes something within us. So I think that as a doctor, it is my responsibility and my duty to also upgrade myself to that level where I can see the wholeness, where I can see that whole aspects of it, and to take a little bit of extra um, pause, and choosing to see the greatness within them, and that it brings out just so much beauty that me as their doctor, I wonder if they're blessing me more or I'm
Yeah.
blessing them.
Right.
So I think it truly becomes a privilege to be able to be of service, and any little steps that they take. For example, I have had kids that we have put appliances in their mouth, and they have been able to walk. I have had kids that we have we have done certain things that it's like their breathing and airways and sleep has gotten better, and they've started reading and writing, and so many little yet profound changes has been created. So but it started with that pausing and just making sure that I see that wholeness within them, and that's such an important part of the whole journey, with whether you're a doctor or not. Like, when you come across anyone, I think it's a really, really beautiful thing to experience.
What an amazing story. And, that's part of my secret and why I feel like I've been so successful and blessed in each of my careers is because it's not about what I've received to some
Yeah.
extent. It's about the success story of the people's lives that I'm impacting. And I guess
Yes.
that is selfish because I feel good about that when you see a breakthrough, when someone, accomplishes something that they never thought they could accomplish. It's just such an amazing experience. I'm sure you see that all the time,
Yes.
which kind of
Yeah.
leads me to really my concern with present day, with COVID 19, with school lockdowns and closures and business closures. I mean, humans are really meant to be a part of a community.
Yes.
to interact, in face. So even though we're adapting, we're doing lots of Zoom calls, and
Yes.
it's different than being in person. I mean,
Yeah.
should parents be concerned about the learning loss that's occurring with children, specifically not being in school, the potential for regression because of not having human interactions? Um, what can parents do right now, to kind of mitigate the damage that might occur because they're not having those human interactions and contacts? I'm really concerned about the social and emotional development of our children. What can parents do right
Absolutely. I wish I could tell you I have all the answers. I don't, So the virus, it leaves so much ambiguity, and it's such a new thing for all of us. And I think that there's a lot more that we don't know that we do. However, there is a substantially important philosophies that I carry in my life. First is love versus fear.
now?
Every action that I take, I ask myself, whether about my children, my practice, myself, my health, is this out of love or is this out of fear? And my answer is, every time that it's out of fear, it's the wrong answer. It's the wrong way to go. Every time that it's out of love, then it's the right way to go. Even if it ends up in somewhere that I don't necessarily feel like it's like for me, that it's really, really great. It might be like for the highest good of all concern. So the love versus fear, it's a big thing. Second thing is, I always have this thought in the back of my mind, mind the light, not the darkness. So, and that comes through the same thing when it's like mind the health, not the disease. What I have encouraged so many of my parents to do during, and supported so many of my parents during this time, first of all, turn those TVs off, because all of those fear based stuff, you might not realize it, but it's creating so much anxiety, not just in you, but also in your whole family. There is substantial amount of inaccurate information that is being portrayed, and it's very difficult for you to decipher the truth versus the fake news. So don't even bother. Just turn off the news, turn off all of those things. You don't need to know about all the details of things, and there's a lot of fear-based stuff that it's out there. So because that's what media likes to do. Just that's how
Right.
they get the news going, and more viewers. And to realize that the more that you go in fear, the more that your immune system become compromised, and the more that you become a better host to a variety of viruses, not just COVID-19 virus, but a variety of COVID virus, a variety of virus and bacteria infection. So the more that you're able to kind of just shut everything off, tune in, spend time as a family, together, walking outdoor, however, gardening, things, there's so many things. Then start looking at your life and see, what are some of the small or large steps that you can take towards your health. I had a lot going with my hormones. 48 years. I just turned 48 a couple of weeks ago. So things are shifting for me. So I couldn't like lose some of the weight after my second baby. So since last September to now, I've lost like 35 pounds, because I was
Wow.
able to actually take a look and, do the intermittent fasting and the keto diet. And that has been really working for me in so many ways, and shift things in such, important ways for me and my health. We started a garden. We got some animals. That we have some chickens that we kind of get our own eggs. Um, these are some of the stuff that I feel like as an individual. I was meditating, I was doing all of these things before, but I still took a deeper look and see what are some of the ways that I can increase my health and well-being on all level, physical, emotional, mental, and spiritual. And then at the same time increase the health and well-being of my children. So we decided to kind of create a little tiny pod, where some of the families that they have the same like-mindedness, the same health orientation, the same habits as, being very cautious to kind of interact with my kids, so they can still get the socializations and everything that they're supposed to get, but at the same time, like, create something that they are that we're all minding the health and minding the love, and not necessarily kind of getting stuck in all the fears and anger and frustrations that it's out there. um, I don't know what the true, and I think the answer is different for each family. But I think if we actually take a look at, like, oh, what's happening with that long lasting anxiety that I have always experienced, and now it's like multiplied, and it's so much more. Perhaps this is something that I need to take a look at, and instead of making my children to wipe their hands 10,000 times with alcohol, I can take a look at that anxiety and take this time through so many, available venues that there is. I mean, the beauty of this COVID is everything has become online, and we have access to so many doctors, to have access to so many uh, yoga classes and breathing classes, and you name it. So take a look at that and see, like, between food and practices and everything else that might have been, like that anxiety that most likely started from very, very young, 6, 7, 8 years old, and it just kind of like grew as your responsibility grew and as the world changed. Maybe I can address that, and that's my way of contributing to a forward movement. Perhaps I can take a look at, like, where I'm being judgmental. People, they ask all kinds of questions about mask, no mask, and all that stuff. I said that I prefer not to focus on that, because there's plenty of people that they have an opinion about that. But I prefer to look at the larger question, of how judgmental we become when we see someone that has an opposing view,
Right.
and how right away we want to separate them, and then use that as like, well, COVID, it's a global thing that has happened, right? It's the
Yeah.
first time in my lifetime and your lifetime that we are facing a disease as the entire planet.
Right.
Nothing has ever happened like this before.
Right.
So perhaps this is a point of unity that we can experience instead of the separation because of our ideas and our belief system. Perhaps it's an opportunity for me to be able to completely sit with utmost love in my heart, listen to your opinions that might be 100% different from me, and really still honor and love you and respect you without getting angry and positional and calling you names. And these are the things that I see it. I was just talking with some other moms. I have every other week I have a homeschooling optional kind of Zoom call for all of us to kind of see what are some of the um, opportunities that are out there for our kids. And I was kind of talking about that. I said, that's one of the things that I want my children to learn through their educations, to be able to know how they can debate without necessarily becoming
Right.
insulting toward each other,
Yeah.
to have a completely different opinion than someone else, and still respect them, and still honor them, and still be neutral, as much as, because that's not the world that I'm seeing right now, at
Right.
least with the COVID. And you be the change that you want to see in the world. And it goes with the same thing. I want, like, my kids to be the change that
Right.
I want to see in the world. So how can I bring that kind of an education to them, where they honor every single human being on earth just as much as their fellow Americans, or I don't know, fellow whatever country. And at the same time, knowing that every plant and every animal, and it's still part of them. How can I bring all of that into the surface? I know I'm getting really
Yeah.
philosophical,
No, I love it.
but
That
but
is
it's a larger conversation, I feel, that we need to have, rather than getting into the boggle down into the details of it, although the details are still important and the
right.
immediate things are still important. But I think I would love to see larger conversations at this time, because I think we need it. And that's why we're in the place that we are, because we need to have those larger conversations.
Right. You give some great advice, and I think it's vital for even people that have newly found that they're depressed or have anxiety because they're
Right.
unemployed, they don't know how they're going to make rents, or
Yeah.
just the different stressors that exist because of the situation that we're in. And I agree wholeheartedly. I think I've always tried to come at issues, no matter the issues, from the perspective of I don't know what I don't know. So being judgmental, I mean, you don't know if somebody, is not wearing a mask because they have some asthma or some type
Yeah.
of other ailment. And there's already so much of a stigma, especially
Yeah.
for people in the special needs community with their diagnosis individually and or their families. So we don't need to add this second layer, and we have got to get rid of this shame culture and this cancel culture. And really, I agree that there's an opportunity to come together, as a state, as a nation, as a global human race to address and do the things that we need to do that are good for everybody. There is a huge opportunity. I want to thank you so much for your time. Like I mentioned earlier, we could
Absolutely.
talk forever.
Thank
How
you.
can people find out more about you and your practice?
Sure. Well, I have an Instagram, Dr. Sherry Sami, DrSherrySami. And I also have I'm starting a Facebook thing. It's called Conscious Chit Chat with Dr. Sami. And we're just kind of in a process of also starting some podcast. And my practice name, it's called Happy Kids Dental Planet. And I would love to just hear from people and hear. And the other thing that I wanted to actually say, I don't know if you can see it, but we also have a nonprofit organization called Love Button Global Movement, which is basically like bringing loving love as a common language globally. So we do this through many different things, building orphanages, supporting homeless populations and everything else. But this year was supposed to be like about early education and bringing the whole emotional well-being into early education as in the classrooms, as well as into medical school. So the whole bedside manner and everything else. Again, one of the things that you said that was so brilliant, it starts with listening, right?
Mhm.
And so we had these we would go to medical school, have like a whole day, and we were planning to have a 2-year education about this, hopefully in the future. But it was a whole day of just like, it was called heart-centered listening and seeing the loving essence. And what would be like, basically the person sitting across you, they're going to start talking about a certain situation in their life that is challenging. And I can't believe how many of these medical students, like, they just kept like interrupting the person and wanting to give advice. And we had to say, like, no, you need to just stay quiet, stay in your heart, and allow the person to be able to you don't have to answer every single thing and solve all their problems, but that quality of listening, it's going to carry you so far in your practice. And that was like one of the things that was one of the things that we were teaching medical students. And we were hoping that within a 2-year period, we would actually increase the emotional IQ of these future physicians tremendously, as well as those younger ages, that like, what does that look like when you have anger? What's the difference? What do you do with that anger? What do you do with that frustration? How does it look like to acknowledge and tune into your own anxiety? So we had a teddy bear that would go inside the classrooms, and that teddy bear would be basically a point of starting the education. And then they would take the teddy bear home, each one of them, for 1 week, and basically do acts of kindness and say how they felt about it. And they write about, journal about it, put pictures in their journal. So that was supposed to be like basically this last year and this year especially mission, and see what kind of changes we actually see in their emotional well-being. And hopefully it will kind of make a little bit of a change and make it somehow, but we're brainstorming about that. But that's another thing. So follow us at lovebuttonglobalmovement.com, and just kind of be part of the solution. Volunteer, donate, um, bring up with ideas, be part of the brainstorming about how, given the circumstance, how we can be of service, of a more loving service to each other. If that there is that single mom that needs a little bit extra help because she has to go to work and there's nothing, no options with the zooming that it's available to her, how can we be of service to her? Find out about your neighbors, what challenges they're going through, and try to see how you can be a part of solution rather than just protective toward yourself, because I think that's where the conversation is coming through right now.
Great. Thank you so much, Dr. Sami. Thanks for coming on. We'll be in touch soon.
You're welcome. It was such a pleasure and honor to be with you, and so much love to you and all of your listeners.
Thank you. Everyone, so I hope that you enjoyed that conversation with Dr. Sherry Sami. She is so right. Right now, I was reading an article, I think yesterday, that was saying that, nearly 77% of conservative or Republicans feel like they can't talk about their religious or political beliefs. And there's just so many people nowadays that think that they're going to be judged. And we need to take an approach of love and understanding and tolerance. And part of that comes with bringing balance to Sacramento, bringing people who have come from different experiences, but really want to look at pragmatic solutions that can lift, they say the rising tide lifts all boats. And that, unfortunately, with the policy coming down from Sacramento, is not happening. So I hope you enjoyed our time. Visit my website at SuzetteValadares.com to learn more about me and the campaign. And I will see you guys next week. Thanks.